All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, community pharmacist of the world. And so we're going to get back into our discussion about COVID-19 and kind of how it takes care of us and what we need to do. So when I left off before the caller called in, we talked about the two major ways by which we are compromised, and that is through inflammation and through blood clots. And inflammation kind of goes everywhere. Blood clots kind of go everywhere. Now, why is this an issue? And if you think about your organs, excuse me, they require blood flow. They require unimpeded blood flow and oxygen. And so your lungs, if there are blood clots in there, then you're not going to be able to get the blood that you need or the oxygen through your lungs. And the inflammation as well is tightening up the vasculature, the vessels, so you're not able to get the blood or the air through. And that's what the importance of inflammation and blood clots is for. So before we found out what the major mechanisms were, we were just pumping air and people were still passing away. And that's because they needed to be on blood thinners as well. And so now that we know that blood clots and inflammation, now we have added corticosteroids to the treatment therapy. Now we've added blood thinners, anticoagulants, and people are surviving better. So for those of you who have hypertension, those people were passing away via strokes because you would have a blood clot get into the heart. And if the heart is not able to pump blood everywhere, that organ is going to die, or it's going to manifest as a heart attack or a stroke. People, even the young people, were dying from strokes because they were getting clots in their brains. All right, so what can we do about it? We need to maximize our benefit by getting our blood pressure under control and making our heart as healthy as possible, and our pancreas, which is the organ involved in diabetes, getting it as healthy as possible. So we need to reduce the inflammation in addition to taking your prescription medicine. And I know sometimes that even though you're on your medicine, your numbers will still be out of whack. We want to add this to your prescription medication so that we can get a better outcome. So what beetroot juice does is a natural anti-inflammatory. So it's going to reduce the inflammation in your heart and your pancreas everywhere. But not only that, it's going to help reduce your blood pressure. And so your blood pressure is not kicking really high and compromising your heart and making the heart muscle weaker, getting your blood pressure under control. It is also helping those of you who have diabetes because it will lower your A1C, it will lower your fasting blood sugar. Not only that, it also reduces your cholesterol as well. So if you take care of those three things, you lower your cholesterol, your blood pressure, and your blood sugar, it's going to increase your likelihood of surviving COVID-19. Now, just because you have hypertension, diabetes, there are other conditions whereby you're going to be compromised as well. So we had the gentleman call in and talk about dialysis. Kidneys are another issue. So people are also passing away because of kidney failure. Now you got to think about your kidneys. They require blood flow. They require oxygen as well. And if there's a blood clot occluding one of those tubules, then it's going to cause damage. If there's inflammation in the kidneys, it's going to cause damage and compromise the kidneys. So you got to think of COVID-19 as not necessarily a respiratory disease, but it is a disease that destroys multiple organs. And so if you think about it like that, throughout our whole body, we want to reduce inflammation. So we want to take and eat things that are anti-inflammatory. This is anti-inflammatory. We want to get things that reduce the severity of our condition. So diabetes, cholesterol. If you are a person who has kidney disease, and I would say not on dialysis, burdock root is what I would recommend for you to regain your kidney function and to help strengthen your kidneys. In addition to that, I would recommend everyone get on alkaline water because it's going to make the blood much thinner. It's going to be easier to pass through the vasculature. Many times we are just dehydrated, and that is actually a simple cause of many of our problems. And so for those of you who go to the ER, you notice the first thing that they do is they hook up IV fluids to you, and that's because you're dehydrated. And that's how significant hydration is, but you need to be hydrated with the best type of water that is. So that's something where we filter out the chlorine, the fluoride, the lead, all of those contaminants, and something that is is alkaline, which is a high pH, which helps to rid the body of pathogens. Not only that, no taste, no smell, so it is easy to drink. All right, so we're gonna talk about how else can COVID-19 manifest and cause issues, okay? So we talked about the other organs, but did you know that it can also cause psychiatric issues? And I'm sure that some of the stuff that you've seen in the news lately, that this can kind of explain it. So there's research that suggests that you have inflammation going on in the brain, blood clots going on in the brain, and that COVID-19 begins to change the chemicals in the brain, perhaps. So what you will have is an increase in dopamine, which is the neurotransmitter involved in bipolar disorder, schizophrenia, PTSD. And so they're finding that people who have developed COVID-19 are exhibiting strange or psychotic behaviors. So I guess we can just call it COVID psychosis. And I'll be doing a video on that goes more in depth probably in the next few days or so. So what you want to do to kind of combat that is you need something anti-inflammatory, and you need something that's kind of going to kind of restore the brain chemistry to what it should be. For that, I would recommend our Pharmacist blend hemp oil. And the reason I recommend it is A, it is anti-inflammatory. B, it restores the serotonin that is lost, and that's a big reason why we have anxiety and depression. Our stores of serotonin are low, and so we need to bring the serotonin back up. That is our happy neurotransmitter. That is our satisfied neurotransmitter, and so we want that increased. The dopamine, which is our, high pleasure neurotransmitter that we get when we drink a beer, we smoke a blunt, do a line of cocaine for those of you out there on the snow. All of that will cause your dopamine to raise up. So what hemp does is it balances out the dopamine and brings it down. And I'm sure that some of you who are suffering from bipolar disorder or schizophrenia, that means that you hear auditory hallucinations, which are voices when nobody's in there. And you can also stay up for 2 or 3 nights straight with no need to go to sleep. You got racing ideas in your head. So this can help settle that. Schizophrenia, bipolar disorder, anxiety, depression, and inflammation. So, just because if you suffer and you've noticed that you're a little more anxious than normal because of, the racial tension, the political climate, certainly after that debate, then this is something that you'll want to get and help restore your brain chemistry. Speaking of the debate, you know what? I'm interested, and I know this is totally off topic, but for those of you who watched the debate, call in and let me know who you think won. So just call in, and you don't even have to ask a question, but just let us know, Trump or Biden, who you thought won. Okay, but look, we've got a call here, so let's get to that. Pharmacist on call, may I help you?
Hello?
Yes, sir. How can I help you?
Well, I had a question to ask Pharmacist about if you knew any other way to remove ammonia from my bloodstream, my body.
Man, that is a good question. Removing ammonia?
Ammonia. NIA, ammonia.
Ammonia. There is something called malic acid, MALIC.
Wait a minute. Let me write that down.
Yes, sir.
MACIE.
MALIC.
MALIC.
Acid. Yeah, so what this is, it's a chelator. So what chelators do is they will take stuff like ammonia and all kind of other toxins, lead and all that, in your bloodstream. It will tie it up and pull it on out of you.
Yeah, well, normally your liver converts it into urea, right?
Yes, sir.
But I got severe liver failure and I can't do that, so
okay.
It gets in all over my body, really, through the blood stream.
Yes, sir.
And causes what they call hepatic encephalopathy, which is generic name, I guess you say the doctor for the layman's name is brain fog.
Yeah.
They call it.
Yes, sir.
So I've been taking this stuff called Journalac, which causes, it's like a laxative.
Yeah.
Oh, it's very unpleasant to take that every day, 2 or 3 times.
Yeah, you got to take quite a bit of it.
Yeah, so anyway, you can't go nowhere to do nothing. I was wondering, this malic acid, what kind of effect does that have on you?
You're going to number 2 everything on out.
Uh-huh.
Yeah, but it's
malic acid, that's that acid that goes into your muscles, don't it?
No, I think you're thinking about lactic acid.
Oh, okay.
No, this is this is a bloodstream cleanser, so it's going to attach everything and pull it on out of you.
Clean the blood, huh?
Yes, sir. Yeah, it's a chelator.
Any other suggestions? I need all the help I can get.
Give me a call at the pharmacy tomorrow because I want to look up some other things, and I'll be able to give you a better answer then. The producer's going to flash my number at the end of the show, so make sure you watch the rest of the show and give me a call tomorrow and we'll discuss what else we can do.
I'm watching the show now.
Well, yeah, you got to wait to the end. Yeah, you got to wait to the end so they can give you my phone number.
Yeah, okay. Well, I see this number. That's just for TV or what?
Yeah, that's the TV.
7587.
Yes, sir. But he's going to give you the pharmacy phone number at the end of the show.
Okay, I understand now.
Okay.
All right.
All right. Thanks, sir.
Oh, I appreciate it. Thank you.
All right. Thank you. All right, everyone. We're on another break. I see the calls coming in. You all stay right there. We'll be right back.